you spend time outside, a dangerous mosquito-borne illness has made its way to the Carolinas. It's called dengue fever. The CDC says South Carolina has 8 cases, while both Georgia and North Carolina have 16 cases each. Florida and New York are reporting cases in the triple digits. So to discuss what this illness is and what symptoms to look out for, I'm joined by Dr. Nita Bijoor. She's a family physician from Oakview Medical Associates in Greenville. So thank you so much for joining us today.
You're welcome.
Yeah, so let's first talk about what is dengue fever and how does it spread?
So dengue fever is caused by a virus called the dengue virus, and there are 4 subtypes, basically transmitted through a mosquito called the Aedes aegypti mosquito. And you get it when the mosquito bites an infected individual, and then the mosquito carries the virus and then goes and bites another human, and that's how it's transmitted. So it's very common in tropical and subtropical climates, and we're seeing quite a few cases now here.
And it's my understanding that it's spread over to this area because of people traveling, taking cruises, going down there. So what are the symptoms to look out for and what you should, when you should be concerned?
Yeah, so I mean, some people don't have any symptoms. It can be range from asymptomatic and it's just self-limiting to really serious ones like high fever. You can have a skin rash, also some fatigue, headache, pain, severe pain behind the eyeballs. Also, if it can get really severe in about 10% of the cases where it requires hospitalization. So you can have vomiting up blood, vomiting, nosebleeds, blood in the stool, and that's because it can affect the platelets and the liver. So it can get pretty serious.
Okay, so at what point should you go to urgent care or the hospital?
That's a great question. So symptoms usually start anywhere from 2 to 7 days, sometimes 14. With the fever, body ache, and so if you have any severe warning signs like the blood in the stool or the vomiting, of course you must seek emergency room attention. But definitely if you've been bitten by mosquitoes in a mosquito endemic area, like if you were out nowadays, you know, near swamps and stagnant water carries a lot of mosquitoes, and you've been bitten bad, if you come with any nausea, rash, fever, do get it checked out and get tested.
Okay, so what's the best way to protect yourself? Obviously, spray, things like that?
Yeah, so number one is protective clothing, and the mosquito bites are more prevalent in the dawn and dusk time. So just making sure if you're taking an early morning walk or going out in the evening, wear loose fitting cotton clothing. Light colors seem to reflect off mosquitoes also, and you can see them better, right, against white clothing. And then the insect repellents. Actually, CDC website has EPA certified insect repellents that can be used.
Okay, so check their website to look for maybe one that's best for you.
And nowadays you can even treat the clothing and the gear with the spray before you put those on.
Oh yeah, that's a good idea. And I know they say like when you have your pants on, tuck your socks over your pants. So the mosquitoes, same with the ticks, they can't get in there. So all right, awesome, good tips for people out there. All right, thank you so much, Dr. Bijoor.
You're welcome.